Sure.
Hi, it's John Kanellopoilos from our center here in Athens, Greece, the Laser Vision Ambulatory Surgery Center, clinical professor of ophthalmology at NYU Medical School, New York City, New York. Of course, the subjects that were known globally is keratoconus. We know keratoconus comes from two ingredients. I have to inherit from one of my two parents a predisposition to keratoconus, and I also have to be rubbing my eyes. It ignites in puberty, so around 15 for boys, around 13, 14 for girls. Unfortunately, we diagnosed it much later on, probably early 20s. And this is a young lady that we had treated several years ago. We can see the marked improvement with our protocol, Athens Protocol CXL, before and today, and the difference achieved, before and today, and the difference achieved. But is this enough? Cross-linking, even with the Athens Protocol, Excellent Vision 2020, we saw today that 5 years after her initial cornea cross-linking procedure, the left eye is starting to be again active. And we see that in the epithelial maps. The epithelial maps show activation, or if you may, significant eye rubbing. And this happens during sleep. Now we have a do-it-yourself trick to create a mask that will protect your eyes from eye rubbing. You take two sleeping masks that are pretty rigid, and here we have two masks. And we'll provide you, or you can get it from any pharmacy, an eye shield. This is a clear eye shield. They're sterile, we use them very often after procedures. And we place an eye shield in the shape of each eye, so one here and one here. And we need to find somebody in the family or a friend who's good in sewing. I don't know if that art is still around. So once you have the two shields, you place the second eye mask on top, and you sew the edges so it all becomes, like in our example, one unit that has the shield inside. So that is the way we create this. There's different types of eye masks, but our goal here is to create one unified eye mask that has the shields inside, and it's comfortable enough for me to sleep and have a comfortable sleep. And during sleep, invariably, the eye with the most keratoconus, or only the eye with keratoconus, is the eye that our patients sleep on, usually in this type, in this form, or on the side, but we ask them to video their sleeping habits and empower the hands related to the eyes. Invariably, and in 99% of the cases, they sleep on the eye, and during sleep they rub the eye because this gives them comfort. It ignites a allergic cascade, more histamine, and unfortunately it can reignite keratoconus. So do-it-yourself mask, a key thing to prevent keratoconus progression. In some cases, it by itself to provide keratoconus improvement. John Kanellopoilos from our center here in Athens, Greece. Thanks very much for your attention.